Hello and welcome back to the She Matters Wellness webinar series. I'm Dr. Jaswita. I'm a research assistant here at Wellness by Heartfulness. And today's subject is about hormones, healing, and homeopathy. How hormones influence everything from mood swings to menstrual cycle, fertility, and metabolism. To guide us through this topic, we have Dr. Shivani, BHMS, FD Homeopathy, MA Psychology. She has been an assistant professor and now she is working here as a homeopathy consultant at Wellness by Heartfulness. So we welcome you.
Thank you, Dr. Jashrita. Thank you for having me today. And yes, hormonal balance is very essential for women's health. And homeopathy offers a very gentle, holistic, and individualized approach towards it. So I'm glad that I will be sharing my views on this topic today.
Mhm. Uh, Thank you, Dr. Shivani. Thank you for being here. And many people are curious about how homeopathy works usually, especially when it comes to hormonal conditions. Could you please enlighten us how it works?
Yes, of course. Actually, homeopathy works on the principle of like cures like. That is, we try and produce, our medicines produce a similar, stronger artificial disease in the human body, which repels the natural disease. And because of the minuteness of dose, this artificial disease no longer persists in the body. Also, homeopathy naturally boosts the healing mechanism of the body, which already we have with compensatory mechanisms and other things. As we know that our body has immense capacity to heal itself, we just need
Mhm.
some boost to uh, like work them on. And also in particularly in hormonal related issues,
Mhm.
we have to be very holistic in approach. Like we need to address the physical as well as mental symptoms. So
Mhm.
yes, homeopathy always focuses on the holistic care of the individual. Remedy selection is completely on all the symptoms like mental, physical, emotional, and also it stimulates the natural responses of the body. So instead of forcing any hormonal changes, we try
Mhm.
and restore the balance naturally.
Mhm.
Also, homeopathic medicines are highly diluted, and
Mhm.
that is why they have their gentle effect. But this high dilution does not mean that they do not have curative powers. The
Mhm.
process of serial dilution in homeopathy is it enhances the dynamic or energetic properties of the medicine, and it brings out the active principles and takes away the harmful effects or poisonous effects of the drug substance, and
Mhm.
it does not interfere with the chemical concentration of the medicine. That is
Okay.
why even if medicines are diluted, we have a very deep but gentle action, and also we
Mhm.
have a very low risk of side effects. So
Mhm.
yes, homeopathy has a very holistic approach, and we have a personalized touch to our patients. So yeah.
Mhm. Uh, this just sounds like it looks and also sounds like a holistic approach. Is that what you're maybe talking about? It's like complete approach which is individualized to each patient.
Exactly, exactly. Every individual is different, every personality is different, and homeopathy focuses on that individual quality of the person or the patient. And
Mhm.
we try to address the root imbalance instead of only managing the superficial symptoms. And
Okay.
also we concentrate on the person as a whole. Like always we
Mhm.
have heard that homeopathy treats the patient and not the disease. So we do not have any targeted action on any organs or tissues, but instead we focus on the complete individual.
That's great to know. And I just have some. See, being a researcher, I myself find questioning everything that I see to believe it or not. So, from that angle, is there any very credible or solid scientific research that has been supporting homeopathy in conditions like PCOS or any hormone imbalances? Is there any very quality of studies that have been published?
Yes, there are some clinical and observational studies which explore this area, particularly PCOS
Mm-hmm.
and uh, PCOD. So,
Mm-hmm.
for example, if I recall, there is a study which was published in 2025, and it
Mm-hmm.
found out that women with PCOS who
Okay.
received homeopathic treatment showed
Mm.
improvement in menstrual regularity and the overall symptoms, with around 61% achieving regular cycles in the homeopathy group of the study.
Mm-hmm.
And
Mm-hmm.
also, there have been several pilot studies and case series on individualized homeopathic medicines and their
Mm-hmm.
actions in associated complaints of PCOS, like irregular periods or acne and hormonal imbalance in women. Also, there have been studies in areas of benign tumors like fibroadenoma of breast or fibroid uterus, etc.
Mm-hmm.
And yes, of course, like many areas of integrative medicine, we still need a large scale like studies to focus more on this topic. And
Mm-hmm.
also, it is best used as a part of holistic approach, including the lifestyle of the patient as well. So
Mm-hmm.
yes, we can look forward to some integrative research, integrative studies along with other departments like naturopathy, Ayurveda, and
Okay.
nutrition as well.
Mm-hmm.
So yeah,
That just looks very cohesive, and also when we talk about integrative, that just sounds right. And my next question is about how hormonal fluctuations often affect the mood of a person, especially women. As a woman, I'm speaking for myself and also a lot of women that I know, we experience irritability, anxiety, emotional sensitivity around the cycle. It's like during our cycle, a lot of things happen, which only makes sense to us and not to the surroundings around us. Why does this happen? Is there any, I mean, when we are talking about homeopathy, hormones, and healing, I just wanted to ask you from a personal note, and also a lot of women out there might need a scientific answer for why do we feel all these and fluctuations.
yeah, of course. There is an answer to our fluctuations. And yes, being a woman, I can understand this. That why are you asking this on a personal note as well?
Yeah.
So yeah, hormonal fluctuations directly affect our mood because hormones like estrogen and progesterone, which are the major hormones in women,
Mm-hmm.
they are directly linked to our neurotransmitters.
Mm-hmm.
Neurotransmitters are brain chemicals which
Yes.
like send messages to our brains and nerves and the complete body, particularly. So yeah, some neurotransmitters like serotonin, which
Mm-hmm.
is called the sleep hormone, they
Yeah.
are directly linked to the concentration of estrogen and progesterone in the body. And
Mm-hmm.
serotonin also regulates mood. It is majorly called the mood hormone.
Yes.
So yeah, it can disturb our sleep, mood, and other related physical generals of the body. And
Mm-hmm.
that is why we feel that during the four phases of our menstrual cycle, we are four different personalities.
Yeah.
So yeah, that is what we experience. And this is
Mm-hmm.
because hormonal levels, when they fluctuate, they affect the entire system: the mood, your energy levels, your sleep cycle, your appetite, also your emotional stability.
Mm-hmm.
That we can observe that like at the in the luteal phase we
Mm-hmm.
experience a lot of irritability, and
Yes.
either we feel tired, there is
Mm-hmm.
sleepiness, there's nausea, vomiting. It can be a very the situation may go that women often do not are not able to work. The capacity to work is the work efficiency is drastically affected. So
Mm-hmm.
yeah, this is because the hormones have direct connection with our neurotransmitters. So
Mm-hmm.
yeah.
So, how does homeopathy help with these mood changes?
Yes. So now, as I said, that in homeopathy we have a holistic and individualized approach.
Mm-hmm.
So Holistic meaning every sphere: mental, emotional, physical, everything. So now, as we consider these emotional symptoms during our remedy selection, they become an important part of the prescription.
Mm-hmm.
So when we prescribe the remedy, it works on the emotions as well, and it works on the hormonal regulation along with that. And
Mm-hmm.
homeopathy, because of its gentle action, it just tries to correct the physiological balance rather than adding something, some supplements or some additional things. It just tries to balance the condition, whatever imbalance has happened in the body. The medicine just gently tries to balance it back. Also, we have a longer consultation style, as there is a common notion that homeopaths take a long time to take your history.
Yes.
So that it is a fact, and
Mhm.
it actually helps to express and release a lot of this emotional symptoms like
Mhm.
anxiety or
Mhm.
body image issues connected to PCOS, especially when
Mhm.
there's acne, there's weight gain, and all these
Mhm.
symptoms. And also, it acts as an emotional catharsis, like it releases the suppressed emotions or whatever anxiety the patient is having around these symptoms. So it acts as a release. And also during prescription, we look at the personality patterns or particular emotional patterns which the patient has. Like some patients are very sensitive, some patients do not express their anger, or they may express very easily. So all these symptoms are very unique to their personality, and these unique symptoms are considered along with the physical symptoms for the final prescription of the remedy. So in this way,
Mhm.
we address both the physical and emotional aspects, and this
Mhm.
helps in restoring both the balances together. So yeah.
That's very great to hear. I mean, I've been familiar with the way you people take consultation, and also we just make that word very commonly. We tell that you take a lot of time, and you see a lot of different aspects when you take this case history, which really makes sense why you take so long.
Yeah.
And the next thing I would like to ask you, Dr. Shivani, it's about PCOD and PCOS. People just randomly use these two words and they use these as synonyms interchangeably, which is, are they same or are they any different? According to a homeopathy perspective or according to you, how does it look like?
Yeah, actually, PCOD and PCOS, they have been distinguished on one particular point. They are related, obviously, but
Mhm.
they are somewhere they are different. They are not exactly the same. So,
Mhm.
PCOD is polycystic ovarian disease, which
Mhm.
means that multiple immature follicles are being released by the ovary. And when we go for a USG scan, sonography scan, we can see that the ovarian volume has increased, or
Mhm.
some like pathological changes can be observed in
Mhm.
PCOD.
Mhm.
Short, we can see pathological changes. And in PCOS, that is polycystic ovarian syndrome, it's a
Mhm.
syndrome. So syndrome is like it's generalized. Disease is
Yes.
particular to that part. So syndrome is a
Yes.
generalized term, and it is a broader, what we can say, broader aspect of PCOD. So
Mm.
PCOS is what happens is because of the hormonal imbalance, it
Mhm.
starts to affect the metabolic function of the body. So it's a
Mm.
broader metabolic and hormonal syndrome, and
Mhm.
it may involve insulin resistance, it may involve irregular periods,
Mhm.
acne, weight gain. Then we
Mm.
can see that facial hair, a lot of hair growth is there in women, and there are fertility issues as well in later life. If it goes very chronic, then fertility issues may take place. So yes, PCOS is considered more complex than PCOD, and sometimes on sonography we cannot even spot any changes in the ovarian
Mhm.
volume or in the
Mhm.
endometrial lining. There are no changes at all. We can see everything is normal, but still the patient has all these symptoms of amenorrhea
Mhm.
or weight gain and all these things. So then we have to go for a hormonal profile where we can clearly find out that what is happening in the body.
So, how does homeopathy help in these conditions, like respective to
Yes.
PCOD and PCOS? How does homeopathy work around it?
Yeah. Homeopathy can help in both the conditions.
Mm-hmm.
And as I said, that disease is not very important to us. But yes,
Mm-hmm.
we look for the clinical diagnosis. We look for the unique symptoms of the patient.
Mm-hmm.
So if I have three cases of PCOD or PCOS, the three of them may require different remedy because
Mm-hmm.
whatever profile we are taking from the patient, it is unique to that
Mm-hmm.
patient. So again, we try to restore the balance very naturally, and also we address the stress regarding which is associated with this kind of disorders. Stress, the weight imbalance, body image issues, menstrual irregularities, and also we
Mm-hmm.
can help in infertility associated with PCOS or PCOD. So
Yeah.
yeah, that is a completely different segment where we can go into. So yes, we can help with the hormonal restoration, and along with that, we can help the patient emotionally as well.
Mm-hmm. So, when we're speaking about hormones, I just have one more thing to ask you about.
Mhm.
Um, Hormonal health is always connected with our metabolism and also how our thyroid functions. So,
Yeah.
can homeopathy support with these conditions in consideration of metabolism, how thyroid works around? How does homeopathy work there?
Yes, so the thyroid gland plays a major role in our metabolism and energy levels, and also in the
Mm,
hormonal balance as well. Because we can see that thyroid gland is like it gives you signals if your energy levels are low, or if you are having some adjustment disorder mainly, then thyroid disorders take place. So yeah, in homeopathy, we can restore that imbalance by concentrating on the particular metabolic disorder what the patient is having. And
mhm,
also, we can, along with that, we can tackle the other issues. Like if
mm,
thyroid disorder is associated with PCOS,
mm,
because PCOS is a condition which involves
mm,
the endocrine gland, that is the ovary,
yeah,
and
mm,
thyroid is also an endocrine gland. So
yes,
this whole endocrine system is somewhere it is connected. They are
with
all
the,
interlinked to each
yeah,
other. So
mm,
if one gets somewhere,
affect,
one gets imbalanced, or there's some pathologies there, then the other
yeah,
one will obviously repercussions will be there. So
yes,
in that way, we try to find the root cause, and once
mm,
we treat the root cause, all this chain of the
mm,
other symptoms will automatically subside. So that is what
mm,
we try to do. We try to find the root cause.
mm.
Also, along with that, we focus on the patient as individual.
Mm, so that answers my next question. I was about to ask you, like, again, it becomes subjective and individualized care. So you have answered that, and my next thing I would like to ask you is about many women with PCOS worry about fertility. Can homeopathy help in these cases, like PCOS?
Yes.
What I mean, a female who is younger, 30s or something. She's diagnosed with PCOS and she's worried about her fertility because she's again on her time clock where clock is running away and
Of course.
so
Yeah.
yeah. So how does homeopathy work there?
Yeah. So in PCOS related infertility, we have a very, like I would say, we have a very great role because again we are addressing the same thing, and we regularize the cycle,
Mm-hmm.
like the irregular cycles or amenorrhea if the women is suffering. Then we try
Mm-hmm.
to regularize the cycle. Once the cycle gets regularized, automatically the patient will have a
Mm-hmm.
like
I see.
window
Window period,
for
yes.
planning pregnancy. And also we can help in the general counseling,
Mm.
because in infertility cases we require both the partners to be involved.
Mm-hmm. Mm-hmm.
So it needs a lot of counseling and convincing in a country like us, particularly. So, yeah, so we try to involve the partner as well during the
Mm-hmm.
counseling and consultation sessions, so that
Mm-hmm.
the partner also gets a better understanding of why is this happening,
Mm-hmm.
so
Mm-hmm.
that
That
the
makes
stress and anxiety related around the issue can be addressed. So, yeah, of course, and lifestyle is an important part.
mm.
So need a lot of help from the other branches of integrative medicine, where we
Okay.
need to focus on the lifestyle of the patient. So,
Mm-hmm.
yeah.
Can homeopathy be used during pregnancy? Can we use it?
Yes, it can be used. Of course, homeopathy can be very supportive actually during pregnancy,
Mm-hmm.
because low risk of side effects, and in the, like, yes, of course, terms and conditions applied, that we need a proper consultation and not just randomly taking medicines. So, yeah,
Mm-hmm.
in pregnancy related issues also homeopathy can be very useful, particularly in the like acute conditions like morning sickness, nausea,
Mm-hmm.
acidity, and dyspnea.
Mm-hmm.
Then also we can target the fatigue around pregnancy and the sleep
Mm-hmm.
disturbances as well. Also, the
Mm-hmm.
patient is the pregnant woman is already on a lot of supplements,
Yeah.
so we do not need to handle much of the supplement part. But still,
Mm-hmm.
homeopathy also can support some supplements with the help of biochemic medicines which we have.
Mm-hmm.
So, yeah, we can address that issues also. And for acute conditions, anytime we can use homeopathy during pregnancy. It is completely safe to use during pregnancy.
Okay.
So, yeah.
That's good to know. Mhm. And my next thing is about I want to ask you, how does homeopathy help in menstrual issues like painful periods or PMS, which are very common by the way, and how homeopathy can help us, and another stage of humanhood is again menopause.
Yeah.
And how do we counter those symptoms like hot flashes or mood changes? How can homeopathy help during menopause and also during painful periods? These are two ends I'm asking you about.
Yeah. So menstrual issues like painful menses, which is called dysmenorrhea, or premenstrual syndrome symptoms,
Mm-hmm.
which is arising nowadays. We are seeing that there is more incidence of premenstrual syndrome. And yes, all these things we can target with homeopathy,
Mm-hmm.
especially dysmenorrhea for painful periods. We have wonderful remedies which
Mm-hmm.
can give you instant relief. Like also, there is a myth about homeopathy that it works very slowly. I
Mm-hmm.
would like to bust this myth, because we have seen people whom we have given like a first aid, it has worked. So, yeah, in conditions like dysmenorrhea and irregular cycles, again, heavy bleeding during
Mm-hmm.
periods, dysfunctional uterine bleeding, as we say,
Yeah.
and the PMS symptoms also, mood swings and fatigue and all these things, increased irritability if it is there. So, yeah, the treatment is to correct the imbalance rather than
Mm-hmm.
just suppressing the pain or something. We can see
Mm-hmm.
that a lot of people nowadays are taking just painkillers and dealing with the day. But with
Mm-hmm.
homeopathy, we can really manage these things and we can avoid the side effects which painkillers can produce in the body.
Mm-hmm.
So, yeah. Also, menopause, as you said, that it is a very crucial stage. It's like a transition,
Yeah.
and many women experience symptoms like hot flashes and mood swings and
Mm-hmm.
anxiety around the like irregularity of cycles and all these things. So, yeah, it is very natural, and homeopathy can help to bring back the, like, to soften the this phase, to
Transition
go to
period.
a transition, smoother
Yes.
and comfortable transition. We can help in that. So we have wonderful
Mm-hmm.
remedies for menopause as well. Because during menopause, we can again see that metabolic disorders may occur, like diabetes or insulin resistance, and thyroid
Okay.
disorders. They're very common during menopausal period. So
Yes.
we can, of course, we can manage the symptoms and bring
Mhm.
back the imbalance. We can balance the conditions in the body. So yeah.
That's great. That's great to hear. And one last thing. Before we conclude, what message would you like to share with women about hormonal health?
Yeah, so hormonal symptoms are nothing but the body's way of signaling that there is some imbalance. And with the right lifestyle, emotional well being, and individualized homeopathic care, we can restore this balance very gently and very naturally. So, homeopathy may be very gentle, but its approach is very deep and individualized as well. It focuses not only on the hormones but on the whole person behind the hormones.
Mhm. So, if someone that I know wants to, I mean, address these things, can we come and see you then?
Yes, of
So,
course,
are
you
you
can just,
welcome here at Wellness?
yes, I'm here at wellness anytime. Whenever you
Mhm.
need any support, we are always here.
And thank you, Dr. Shivani, for sharing these wonderful insights. And thank you to our listeners for joining us in this conversation on hormones, healing, and homeopathy. Stay tuned for the upcoming webinar on Love Yourself, Rise Within with Miss Sanjana, a clinical psychologist, happening this Sunday, 29th March. Thank you.
Thank
Thank you,
you,
Dr. Shivani.
Dr. Jashwita. Thank you.